here the vascular preferential of the spinal cord. We see here the anterior spinal, let's move it off, anterior spinal artery, and here the two posterior spinal arteries. Those are the main arterial supply to the spinal cord. Now, there are two main syndromes with stroke of the spinal cord where the anterior spinal artery is occluded and the posterior spinal artery are occluded. Now, more commonly, it is the anterior spinal artery that is occluded. Now, when it happens, we need to understand how and where each of them supply the spinal cord. The anterior spinal cord usually supplies the anterior two-thirds of the spinal cord, namely the motor area and the temperature area, and therefore, and the pain. And therefore, when there is an anterior spinal cord occlusion, anterior spinal artery syndrome, you can anticipate that the patient will have all the symptoms from the level of the ischemia, from the level of infarction and downward. So let's assume that we are talking about the area of, I don't know, some tear or something. So it can cause bladder problems or GI problems, but let's talk about movement and motorics. So it will cause a plagia of the two legs and reduce sensation to pain and temperature, but the patient will have fine touch and will have sensation of the fine touch. Therefore, he will be paralyzed, but he will be able to feel, but not temperature, he will be able to feel fine touch. And when we're talking about posterior spinal artery occlusion, which is less common, we're talking about sensation deficiency, but not motor. So he will have power, he will have motor ability, but the sensation, not to temperature and pain, but to vibration and sensations will be preserved. So he will be able to have power in his legs, for example, but he won't have proprioception. You will have problem walking and moving because the lack of proprioception. So it is much less common, the posterior spinal artery occlusion, namely the posterior artery syndrome, posterior spinal artery syndrome. That's it. This is about the two syndromes, anterior, which is mainly motor, and the posterior, which is mainly sensory. Thank you very much, and that's it.